waiting until the fetal gene will be delivered.
व्हाट्सअप गाइस, कैसे हो सब। आज मैं आपको नॉर्दर्न स्टेट मेडिकल यूनिवर्सिटी का गाइनोकोलॉजी डिपार्टमेंट में कैसे बेबी डिलीवर किया जाता है इसका एक डेमो प्लास्टिक मॉडल में सिखाया जाता है, तो मैं वो आज दिखाने जा रहा हूँ। वीडियो को एंड तक ज़रूर देखिएगा।
You need blankets for one blanket. You need to control the posterior part of the perineal. Two blankets you need to dry the baby. One to dry the baby, and second to cover for heating. See the small fontanelle of the fetus in anterior position. This is occiput anterior presentation, and sagittal suture in anterior posterior diameter. You will come for the exam. Never come with the gloves that are on your hands. Put it in your pocket, because if you are coming with your gloves on your hands, you will forget the moment when you need to wash your hands and your gloves. You are coming in, you are introducing yourself. You may introduce yourself as you like. The ideal variant is medical student, or I'm a doctor. What are maternal problems during this period of time? The lacerations, to minimize maternal trauma, maternal lacerations, and second, minimize fetal troubles, fetal trauma, and fetal heat loss. We will ask the questions. What are questions included into the checklist? Your name role, asking the patient's name, call for assistance. You need blankets, you need something to cut the umbilical cord, you need something to clamp the umbilical cord, you need antiseptics, you need some water, everything that you need me. Yes, and you don't need run away and get problems. Bony pelvis consists of several bones. Yes, these are pelvic bone, left and right. Yes, this is left, this is right. This is sacrum. This is coccyx. Every pelvic bone consists of 3 bones actually, but they are connected without any junctions. But between pelvic bones we have junction as a pubic symphysis. Between sacrum and pelvic bones we have sacroiliac joints. And these are, and also between sacrum and coccyx we also have a full articulation. So that means that in these junctions we have some degree of movement. Especially when woman is in late pregnancy, these junctions are much more movable, and they are more elastic. The cartilages are edematous, and that's why they allow movement. What kind of movement we are interested in? The pubic symphysis is distending, increasing the size of pelvic cavity. But what else is important? The sacrum bone may be extended. May be extended, especially when the fetal head is propulsed through the pelvic cavity. The sacral bone may be extended, and thus increase the most small size anterior posterior diameter of the pelvic outlet. In what circumstances it will happen? It will happen if woman is not lying on her back. If she is, for example, standing, or she is sitting, yes, for example, or semi-sitting when she is elbows. In this variant, we have some ability for the sacrum, some chance for the sacrum to be extended and increase the size of pelvic cavity and more easy propulsion of the fetus. But before you will ask about the examination, you need to explain what are you doing. You will say, I can help you. Do you allow me to provide medical examination? Remove these clothes, and I will ask you to say that I see the fetal head that is over distending the maternal vulva. That means that you are really in late second stage. You really don't have time, for example, to transport woman to the medical center, and you need stay here and complete the labor case. So what do you see? You see the woman who is pushing, and under the pushing effort, the fetal head is distending the perineal. During uterine contraction and pushing effort, it distends. And when the contraction is over and when she stops pushing, the fetal head may return, may go back. But with every new contraction and new pushing efforts, the fetal head will propulse to more distance and stay here. At this moment, you need, first of all, explain woman what to do. What are you planning to do? You see the late second stage, and you right now you need work as a comment. You will explain that right now when you feel contraction, you may push. This formula is ideal, Viren. First of all, please notice that you can't ask woman push without contraction. Push and effort need to be presented during the contraction. Contraction is autonomic. We can't control contractions. They appear by themselves and disappear by themselves. So when to push is logically to during the contraction to increase the power of the contraction. Between contractions, no need to push. This push and effort will be it will be illogic. It will, first of all, still be a problem for the fetus, not propulse, because push and effort itself is not enough. Second, it may minimize the blood supply of the fetus. No need to do this. And also, women will become tired too fast. That's why when you say if you feel contraction, you may push. You ideally report the woman what to do. First of all, and you also use the latest guidelines when we that are recommending for us not to comment by pushing efforts. Then, but you will say, at some moment, I will ask you to stop pushing, and you will open and breathe with open mouth, and you may show how to do this. You need to understand that woman who is in labor process is full of pain. She is not understanding the situation well, and that's why the most simple explanation need to be given to her to understand what to do. That's why you have said, if you feel contraction, you may push, but at some moment I will ask you to stop pushing, and you will breathe with open mouth, like this. Yes. So then, are you waiting? You are waiting for the moment when fetal head will distend to the level of the parietal tubercle. This is crowning, because usually after this moment, fetal head will not return. This is the maximal size of the fetal head that is passing through the vulva. And what is important at this moment to be well understood, this is the most risky moment for the laceration, because the size of the fetal head is most large. That's first. And second, what is very important, that just the suboccipital fossa, this one, will reach the pubic arch, and the fetal head will extend. That means that propulsion will become very fast at this moment. Just this has happening, the propulsion of the fetal head may be very fast. So let's minimize the risk of the laceration by slowing this process. How to slow this process? Remove one force. Ask woman, stop pushing. She has contraction and she is pushing and increasing this power. So we ask woman to stop pushing at this moment, and thus we think the progress will be slower, and that means that fetal head will propulse little bit slower. You need to take a blanket. Why? This blanket has what kind of task? It is covering the anal area. It's covering the anal area. Yes, because defecation is very, very possible during this moment. We use the same mechanism for defecation as push and effort for the delivery. We use absolutely the same. So if the defecation will occur, it will be easy for you to, first, distension of these tissues of the maternal skin will be not equal in all points. We know that distension of skin tissues here in anterior part of the vulva is less than in posterior part of the vulva. So in Russia for many, many years we are providing so-called hands-on technique of perineal safeguard. And what we think, we are improving in the process and minimizing the risk of laceration. Put attention that I'm saying we think, we believe, and so on, because these things are not absolutely scientifically proved, but they have a long history. We have some kind of tradition, and that's why I'm teaching you. And what is the idea? First idea you have got to remove the pushing effort and minimize the speed and power that will propulse the baby through the perineal. Second moment, we think that because of different distension, we can move this skin down and thus minimize the distension in the posterior point. So, what are position of your fingers? The position will be always this. During, for example, when we should discuss third labor stage, when we should discuss cervical screening management, I will show you quite the same. Please remember the position of your hands up. Upper hand is this one, lower hand is this one. So, when you will show this movement, what are you doing? You are actually removing the maternal skin from the fetal head, helping yourself to visualize the parietal tubera and understanding the correct point to say, woman, stop pushing, breathe with open mouth. This is one. Second, you are trying to move the skin down. It is you are keeping your fingers on maternal skin. That's first. You are not putting them on the fetal head. This is prohibited. That you are distending and using your fingers to remove the skin from the fetal head. This is correct position of my hands. And at some moment, I will say stop pushing, but you will still propulse because you are contraction. Okay, so stop pushing, and you are propulsing because you are uterine contraction. Okay. Press better. Так. Look at position of my fingers and also look that I'm removing the skin from the fetal head, but not pressing on the fetal head. I'm not touching the fetal head. Little bit more. Powerful. Pulse. And look that I have changed them in this. This hand right now is free for me. And I can remove the fetal skin by myself. What is the task of the lower hand? I'm waiting until the fetal chin will be delivered. Chin. When you feel the chin, remove the blanket, you don't need it more. So you see fetal head is delivered, and first thing to do is to check for the umbilical cord. It may happen that it is rather smooth. That's why, and sneeze, and that's why maybe you will not find it. It is not a problem. If you don't see, just pronounce it. I'm checking for the nuchal cord. I don't see it. I'm checking for nuchal cord. It is here. What to do? Next, if it is loose, try to remove it. If it is loose, you need to remove it because you don't want to pull the placenta. But how to remove correct? Put attention that I'm removing, first of all, slowly. And second, I'm using two hands. And just removing the umbilical cord for the fetal head. 4 fingers of every hand and slowly, gently, you have a lot of time. So removing the loop from the fetal head. That's all. Then you will say, I'm waiting for spontaneous rotation. Better to keep your hands out. What is important to understand? The fetus is rather large when we are comparing to the true pelvis cavity. And that means he needs to do specific movements to pass through. First of all, he is keeping everything well flexed. Yes, and fetal head is well flexed. And thus he will minimize the size. Second thing, his sizes are, you need to understand that shoulders, for example, are larger in transverse diameter than in anterior posterior. But for the fetal head, it was controversial. Fetal head was larger in anterior posterior diameter. Right now, shoulders are coming. And that means that for their delivery, they need to rotate. Fetal head was rotated inside. It was not visible for you. Only for vaginal examinations we can notice this, or by ultrasound. But for the shoulders, you will see spontaneous rotation of the fetal head. Spontaneous rotation, why it will happen? It will happen because of uterine contraction. What may hurt to the spontaneous rotation? Active pushing of the woman. That means that we have stopped pushing when we see the parietal tubera, or when we see the width of the palm. And right now we can repeat our request. Please still don't push. I'm waiting for spontaneous rotation. And from the side of the fetal back, put your hands on the fetal head in this way. Ideally, maybe you will control the shoulder. Why? Because at this moment we are trying to deliver the shoulders with, we are helping to deliver the shoulders. When the rotation has occurred, the pushing for us is not a problem. And that's why we can ask a woman, push little bit, and you are pressing fetal head down. What are you doing? You are flexing. You are flexing. You are not pulling. You are flexing down. When you see the middle of the shoulder, you are flexing anteriorly. And what do you see? You will see, no, because she is pushing, yes, a little bit. And what you will see posterior shoulder. When you are flexing up, you will see posterior shoulder. Please stand on this moment. You see posterior shoulder. You may deliver the fetal trunk, but please put attention that I have changed the position of my hands. Means that your task is clearly press down, clearly press up, but when you will see the posterior shoulder, at this moment, please change the position of your hands. And right now, control the fetal neck mostly, and no pull for the fetal head. Because if you will still keep fetal head and pull, it will be again the same mistake as with umbilical cord. So change the position of your hands and control the delivery of the trunk. Right now it is absolutely unproblematic because this is the largest diameter, and when it is, you see this largest diameter, it is not a problem for fetus to be delivered. I suggested to deliver the fetal body rotating by face down position. Face down position seems to be the best choice for this. Why? Because in this case, you first of all guarantee extension of the fetal head. Extension may happen. The fetal head is very heavy, and fetal neck muscles are not controlling the fetal head. He may extend, and that means he will traumatize again spinal cord. In the case that you protect, you can rotate in the face anterior position. He will not extend the head, but in face down position, he will easily remove lung fluid. That means more fluid will come out and more easy will be breathing in. So it seems that face down position is the best choice for this. Please notice that your hands may move across the fetal body. You can move by your fingers. You can move your hands through the fetal body. If you keep him on the fetal head, you can change the position, please believe me. And then when you are delivering the fetal trunk, it is not problematic because all the trunk is large. I ask you to put the baby on the maternal naked abdomen for skin to skin contact. It's the time of birth. Congratulate the woman with childbirth, and you need cover here with a clear blanket and dry him. How to dry the baby? First of all, cover him with the head. It is not a problem for him to start drying and massaging simultaneously. When you will dry, you need change this one blanket into another dry blanket. Right now the task is to heat the baby, for him not to lose the heat. Cover with fetal head. Head is a very large and important, and fetal head is also losing heat. So, for example, in maternity departments, we ask women to take together with them hats and socks for the newborn. Because these are points that are usually uncovered and usually lost hit. For the baby, it is very important to save the hit. For example, WHO says it is the most important problem for the babies for the neonatological mortality in low-income countries.
To maintain the heat of the head.
To maintain the heat of all body.
All body.
All body, yes, of course. So, and that will be